This is intracranial dysfunction part 4. So how do kids get head trauma? Falls, motor vehicle accidents, sports injuries. They can have a pedestrian or a bike accident, and usually that's, they're hit by a car, or child abuse. So falls are a common way. So what happens in a head injury? Well, a kid is a little different than an adult because they have that big head and a weak neck. Their muscles just aren't as strong, and that's what makes them more at risk. They fall on their head because that big heavy head, more surface area, so more bleeding, and they're especially vulnerable to acceleration, deceleration, which means they fall accelerating fast and then sudden stop, and the brain inside there, crashes against the skull and kind of bounces back. And as it moves, it shears it, that tentorium at the base there, it's rubbing on that and can tear vessels, or up above, shearing forces can do injury. So here's what we see with kids. They hit and the brain bounces into the skull. This is the coup, and then it bounces off that and hits the back, and that's the counter coup. So they often have an injury in two places, even though they hit in one, but that shifting of the brain can tear vessels or do damage down here as it rubs across the tentorium. So head injury can happen from compression, the swelling and squeezing, or that tearing or shearing. You get the bruising at the point of the coup, the point of the impact, and opposite of it, that counter coup. And those falls where you get that sudden deceleration is a big problem for the shearing, and then severe compression as you get swelling in there pushing down on that brainstem, which can herniate the brainstem into the tentorium. So the worst kind of skull fractures are basilar skull fractures. These are the ones kind of at the base of your skull here, right? I'm not counting the mandible as the skull. These are also the ones kids tend to get if they fall and hit their heads. It can be, again, any of those bones along the base there. The battle sign, that is what we see here, that bruising behind the ears. And then the raccoon eyes, you see here. If you have leakage coming out of the nose or the ears, we're worried of CSF, right? That means there's been a tear to the dura and CSF is getting out, which also means germs can get in. So now, as well as the swelling that we might see, we're worried about infection, meningitis. The way to be sure if that's CSF or just a runny nose is to use a urine dipstick and check it for sugar, for glucose. If there is sugar, positive for glucose, it's CSF, it's not mucus. So if there is that leaking, we're going to put them on antibiotics, and then we're worried about associated cranial nerve injuries as well. So take note, stabilize a child's spine after a head injury until a spinal cord injury is confirmed or ruled out. So if a child has fallen, any movement, we're going to make sure we're log rolling them, stabilizing that neck, and getting a C-spine collar on them as soon as emergency personnel come. Another take note. If a child has any sort of head trauma, do not suction or put an NG through the nares. If there's been any facial injury, because there's a risk that it will go through a fracture in one of those bones and into the brain. And although bleeding from the nose and ears is uncommon in children, it needs further evaluation. The watery discharge, as I said, if it's positive for glucose, then we're worried that it's CSF and that it would be from a skull fracture. So what kind of skull fractures are there? Infants and infant and child skulls tend to be a little more flexible, which is why we don't get as many fractures. When you do have one, it can cause brain damage, but it may not. You can tear an artery and get an hemorrhage. A linear, so let's just kind of describe some linear skull fracture. It's just a single line. A depressed is when it's kind of dented, pushed in. Comminuted means there's multiple fractures that kind of connect together, and then basilar is that along the base of the skull. Concussions, contusions, lacerations. So what's the difference of these? Well, basically a concussion and a contusion aren't much different, except a concussion, nothing shows up when we do a CT of the head. A contusion, we can see an area of bruising on the brain. But both of them, some kind of traumatic thing happened with some alteration in mental status. Concussions are the most common. They're transient. You get over them. It's really common. The person falls. They're confused when they wake. They get back up. They're kind of mumbling, not making sense. If you ask them, they have amnesia of the event. They often do not remember the event. Contusion is the same thing, except, like I said, we can actually see bruising of the brain on the CT. So bruising, a laceration, now we have torn cerebral tissue. So that can be from like a fracture that got in there, or somehow the tissue tears. Shaken baby syndrome. This is a real concern. When I shake your shoulders, your neck is nice and strong and your head doesn't move that much. A baby, you shake their shoulders because that big heavy head and weak neck, their head flops more than their body. And the brain, remember, is bouncing off the sides of the skull in there. So you get all these little micro tears all over in there. In the oh, I thought I had a picture. Anyway, the other thing you get is little micro tears in the retina. Shaken baby syndrome is really about the only thing that causes those retinal hemorrhages, little mini all over retinal hemorrhages. So when we're caring for a child with a head injury, we said level of consciousness is our earliest best sign, right? So we're going to be assessing vital signs, level of consciousness, pupils. Sedatives, usually contraindicated because we want to be able to assess the level of consciousness, but if they're really agitated, that's going to raise their intracranial pressure, so then they will be given. So it's not an absolute contraindication, but it's really got to be weighed if it's going to be better for them or not. A child who has increased intracranial pressure, we're going to raise the head of the bed 30 degrees, and that's to help drain venous return, and we're going to keep their head midline. We don't want to compress either of the jugular veins. We're trying to get as much blood flow back out of the head, not let it stay in there and increase the intracranial pressure further. So when you have a head injury, airway is always first. Make sure you have a good airway. We're worried about CO2 because increased CO2 dilates blood vessels, brings more blood flow to the brain. We've already got increased pressure. If we're adding extra blood, we're going to increase the intracranial pressure more. Right? Cerebral hypoxia more than 4 minutes can cause irreversible brain damage. So we're going to position them, as we said before, 30 degrees, head midline. If we have changes in level of consciousness, we're also worried about them aspirating. So that's a concern. We usually will have an empty stomach. We might put down an NG to drain the stomach juices out just to be sure nothing's going to be there to reflux it and aspirate. Suction only if necessary because suctioning increases intracranial pressure. But we're maintaining that airway first. So you may have to suction to keep the airway open, but not unless it's necessary. We're going to be doing ABGs, watching those, probably giving some oxygen, and then we might hyperventilate to try and vasoconstrict. Near drowning, which we're starting to call submersion injuries. This is the second leading cause of unintentional injury-related death between 1 and 14 years, and most of the time it's under 4 years. These are our toddlers and preschoolers who are mobile and the pool looks fun, but they really can drown in anything. It doesn't take much water in a bathtub. An infant can drown in just a few inches of water, so they should never be left unsupervised. Toddlers, they have that big heavy head and they lean over, they can fall into something and get stuck, so they can drown in buckets of water and in toilets. Preschoolers, it's usually in the pools. Older children, it's usually in natural bodies of water, that they do something dumb and then drowned. And here you can see how intriguing that pool is to the child. So fence your pools if you have a pool. Non-accidental head trauma, that shaken baby syndrome, a blow to the head, or hitting the child's head against wall, furniture, or floor. And those are all sad events.